When you're talking to the surgical team and the doctors, because you said a few things that I wanted to kind of circle back to, but you said that she's waiting to make the decision. You said you were advised to wait until she can't, what was that, till she can't take it anymore or she goes septic? Is that?
That's what the surgeon said. She's like, well, when does this happen? And he said, when you can't take it anymore. And I think it's because she's having a hard time making that decision. Now, she has some tests scheduled in 2 weeks, a CAT scan and some kind of a oxygen flow thing to see how far the circulation goes to her leg, so they can determine the level of the amputation. But, the doctor, the one surgeon told her he thought it would be a transfemoral amputation because there was so little flow. Like he had said they had tried to save the knee, but he didn't think that they could save that knee.
Well, that was one of the things that I was going to say. I mean, you really want to aggressively, if you're going to be talking to other surgeons, and I'm not saying that you have to, but if I was, second opinions are second opinions. What I would look for, is there a way possible to save the knee? The emphasis of that would be a priority. If I was in that situation, she's still trying to make a decision because it hasn't been done yet. Secondly, I just want to emphasize that if she's got an active gangrene infection, the longer she waits, that's spreading. And, that's going to lead to not only the window where maybe here's the thing. If you can try a surgery to save the knee and it doesn't go and you do a revisional surgery again, you can always go back and have a second surgery. But once that knee's gone, it's gone. So if somebody tells you there's a shot, because we do these kind of consultations all the time, and Nate, I want you to, you agree with me? I'm sure. Then if somebody's willing to take a chance, I say take the chance. And I'm just kind of reiterating this information to you. Of course, it's our opinion, but you guys are trying to make decisions. And secondly, try to get this information sooner than later, because that is going to be part of that process. And here's the thing you need to understand: the longer her residual limb is, if she is a transfemoral amputee, the better chance she has for success. So even if it is an above the knee amputation, that limb's going to be shorter and shorter the longer you wait to make that decision, which is going to highly impact her probability for success. So I'm just the part that concerned me was where you said they're kind of, I don't know, I think this is more time sensitive. And again, I'm not the doctor, but these are the questions I would be asking when you're talking to the surgical team and you're a nurse, so I'm sure I know you're familiar with what I'm talking about. So, and maybe you've already been through all that and you're comfortable with that answer, but I just did want to say that in case that might be something that you would look at that a little differently and ask some other questions.
Right.